Howdy, Texas. I hope you are having a blessed day. I'm Dr. Suleiman Lalani, your state representative for House District 76. As a physician legislator, I take pride in taking care of ailing patients and ailing policies. Because at my core, I believe in healing. Healing through education, healing through inclusion, healing through representation and legislation. Over the past 50 years, vaccines have saved estimated 154 million lives, about 6 every minute, and childhood vaccination still prevents nearly 4 million deaths each year worldwide. But in this age of misinformation, disinformation, or information overload, it is important to differentiate between the fact and the fear. Important to differentiate knowledge versus noise. So today's Zoom meeting is very simple. Our goal is to bring some experts on the table, people of science, and who can talk about what vaccination has been doing, what is the good, bad, and ugly about vaccination. So the families, the parents, they should know and they can make the informed decision about vaccination themselves. I'm very proud today that we have been joined by Dr. John Carlo. Dr. Carlo is a physician who specializes in public health and general preventive medicine. He serves on the Texas Medical Association Board of Trustees and represents Texas in the American Medical Association House of Delegates. He led Texas Medical Association COVID-19 Task Force. He was also part of statewide response effort during 2014 Ebola outbreak. He's also a former chair of the Texas Public Coalition, where he helped advance Tobacco 21 in Texas. Today, he serves as the CEO of Prism Health North Texas, which provides the area's largest community-based healthcare organization providing HIV prevention and treatment. Thank you, Dr. Carlo, for joining us.
Thanks for having me.
We also have today Dr. Lindy Upton McGee. Dr. McGee is a pediatrician who practices in the Houston area. She's a fellow of American Academy of Pediatrics and is active in Texas Pediatric Society, the Texas Medical Association, and the Harris County Medical Society. She has been trained at Baylor for both medical school and residency. Good, Baylor, I'm Baylor. And completed her undergraduate work at Vanderbilt University. Dr. McGee, thank you for your time and travel and joining us today.
Thanks for having me.
And finally, we have Dr. Tarek Naguib. Dr. Naguib is a professor of medicine. He specializes in nephrology, internal medicine, and infectious disease. His work emphasizes patient care, medical education, research, community outreach. Thank you, Dr. Naguib, for joining us today.
Thank you, Dr. Lalani.
So we are just going to go in and dive directly to save some time. I'm going to ask Dr. John Carlo, Doc, do vaccines work? What is the simplest way to explain their effectiveness to the public?
Well, again, thanks for allowing me to be here. This is a great opportunity to really talk about something that's very, very important to me and just how effective vaccines are. The answer to your question is absolutely 100% yes. Vaccines work. We have an amazing amount of history and success. There are diseases we don't see today thanks to vaccines. There are many things clinically that we don't even know what to expect because simply we don't see the diseases and conditions that in decades past was very, very common. And so we should be incredibly thankful and grateful. I personally am, that I believe that vaccines is the greatest accomplishment in public health that we've been able to achieve.
Wonderful, thank you. And as those are some like polio, measles, things like that, that we still hear here and there cases, but pretty much it was unheard of in US, but now it's trickling back again.
Yep. I agree. I think that one of the more remarkable ones and thinking through is tetanus. I was trained as a general surgeon in the United States. I have never seen a case of wound tetanus, and I've been in practice for over 20 years. I've talked to colleagues around Texas, And, most have not seen tetanus at all. Now, if you go outside of the United States, of course, you will see cases because, of course, it's much more common in places where they don't have vaccines. But, tetanus was universally fatal if you got a wound infection. In fact, it killed many more people than direct wounds in World War I. And yet we don't see it today at all. Neonatal tetanus is another example. Again, just these amazing things we've been able to not see anymore thanks to vaccines.
Well, give us some overview of what you recommend adult vaccination schedule.
So I think the key to understanding the adult vaccine schedule is, first, you really have to be individualized in the approach. And it's very important to talk to your healthcare provider, your physician, and your care provider, because there are very specific vaccines that could be very important for you and your health. But first, there's general vaccines that all of us as adults should always receive. And of course, that's the annual influenza vaccine is the primary one. Great vaccine in terms of preventing flu infection. The COVID vaccine is, again, another important vaccine that we've got to continue to take. It's done an amazing job in such the short amount of time. Tetanus, again, every 10 years, one of those things that we've got to remind ourselves is just something we always take. There's a lot of other vaccines that offer great protection for individuals for very specific situations. As you grow older, there's certain immunizations that you will want to start considering. If you're traveling to other places around the world, vaccines are a great way to prevent having something unfortunate happen to you while you're abroad. Vaccines during pregnancy, another good opportunity to really prevent infections and do a remarkable way to protect you and your family as well. So while we think of vaccines a lot for children, there's many really good vaccines for adults as well. It's a great way to have that discussion with your medical provider and make sure you're getting all the best that you can get.
Would you give a thought for our elderly people hearing about us, about pneumovax and maybe herpes zoster?
Again, these are great vaccines. They do great ways of preventing infections that become more common as we grow older. I've seen some remarkable success in terms of reducing hospitalizations. One of the things I think we have some misperception, and I've heard from patients, is that a zoster infection or the shingles is a minor illness or a minor situation. We've seen some really bad cases of shingles, and I can't say enough good things about getting that vaccine. And preventing that severe case in shingles. It's just really, really good things to do.
So you recommend that our senior population should get pneumovax and should get shingles?
Absolutely. Yep.
Especially if they have chronic illnesses like diabetes and other things.
Yep.
They should
Without question. It's just great medicine. It's just a great way to prevent. Nobody wants to get the severe consequences of either of these. It's just wonderful to know that we have such great tools that we can actually prevent these infections from happening or being more significant.
Well, you have such a vast experience in the field and public health that you do. Any personal stories that's kind of or professional story that would you like to share?
I think the way I like to talk about vaccines is if we were going to have to go under the sea, we'd want to be in a submarine rather than using our own scuba equipment to go down into the depths of the water. And that's how I think of vaccines. That's like being in the sub. It's protective, and it's protective for everybody. If we were all in our own little individual scuba diving equipment, that may work, but it certainly wouldn't work as well. So the best way I like to talk about this is that, we're protecting everybody together, but it does take all of us to agree to be in that sub and not open the hatch. That's part of the community being involved in getting the vaccines and all agreeing to do it as a group and as a community.
That's a great point that you bring up, and I like the submarine analogy about that, because we live in a society, and then we have the responsibility for ourselves and for the greater good of society. So I can say I would not take this. I have my own rights. I can deny that. But when I live in a society, we need to be mindful that we shouldn't be doing anything that can harm us, but can potentially harm others.
So that,
Any thought on that?
That's exactly how I say it. I agree.
Thank you. Thank you. What are some biggest misconception you're seeing it right now related to the vaccines?
Safety. I think we continue, the thing I think is remarkable, if you think about how many immunizations we give across the planet every year, it's 7 billion. And if you think about anything else we do in medicine, there's absolutely nothing else that compares to the number of immunizations given, to the number of side effects that happen. It is safer than taking a baby aspirin. And so I think the safety is a big challenge. We hear a lot about the safety issues, but the numbers speak for themselves. We have a remarkably safe vaccines, and they do remarkably well. I just think that the safety issue is the biggest misperception that we continue to struggle with. We all have to do our part to convey that, remind everybody that these are remarkably safe things that we do, in addition to being effective.
Well, thank you, Doctor. Stay with us, and I'm going to turn my focus to our next guest, and we may come back to you.
Sure.
Dr. McGee, pediatrics and the kids, very important to all of us, and we certainly do not want to do any harm to anybody, but especially our kids. And sometimes there are parents who come with some genuine concerns. So first of all, tell me, give me some quick overview of childhood and adolescent vaccine schedule.
Yeah, we are so lucky right now to live in a world where we can vaccinate against 18 deadly diseases before you turn 18. So we're looking at things that we can vaccinate against: measles, mumps, rubella, polio, tetanus, like the other doctors already mentioned, diphtheria, pertussis or whooping cough, hepatitis A and B, chickenpox, pneumococcal disease, meningococcal disease, rotavirus, HIB, which is another cause of meningitis, HPV, which causes cancer, obviously COVID flu, and then our newest immunization that we have for the newborn babies is RSV, and that one is just going to be just game changer for pediatrics.
Thank you. Wonderful. A quick overview, and tell me how safe is this vaccine schedule? Sometimes we hear that, oh, baby is too young to have that, or you're giving it too early. Can we give it later? Or you're giving my baby a couple of shots together, or whatnot. So what are your thoughts?
Yeah, I think, I feel so bad for parents right now because there's so much information that is thrown at them, and it's so confusing. And parents come to our office with real questions and concerns. And a good pediatrician is going to sit down with you and answer those questions and concerns. And unfortunately, we have the answers. So we know, like was said earlier, that vaccines are very, very safe and effective. It sounds like we're vaccinating against so many things. And it makes parents think, like, how can that be done safely? And one of the ways is that we've learned to work smarter, not harder. So what I mean by that is when I think about vaccines, I think about the immune system being students at school and the vaccine being the guest lecturer. So the guest lecturer comes in and says, hey, you're going to be tested on this later on. If you see it again, I want you to react to it. And what we've learned is when we had those older, especially the DTP vaccine, that I got when I was little, it had 3,000 antigens in it. So that is through like giving the students 3,000 lesson plans. Now the scientists can go in and say, you know what? To recognize that germ, we only need to know one or two things. So now we teach our students only 180 different lessons compared to 3,000 when I was a kid. So even though we can protect against more things, we can do it in such a smarter way that we're not stressing those students out or that immune system out as much. And that's the amazing thing about it.
So some kids who are unable to vaccinate, as you said, they may have an immunocompromised system, or sometime for their religious reasons, they say, or sometime what else. What prevention they should take or notify to the school, so as a greater good, everybody knows that be careful, we are not transmitting any infection, or they are not transmitting any infection.
Sure. And I think, when you talk about kids who are immunocompromised in the classroom, part of that's going to have to be what the parents are comfortable with sharing with the school, of course. There can be different reasons why parents may not want to share a full medical history or not. That's why we should all protect and just assume that we need to protect anyone out there. But if they do share with the classroom, there are some schools that are able to make sure they're in a classroom environment with kids who are immunized if they're in elementary school and they're with the same kids all day, every day. Once they get older and they're switching classrooms, that's not as possible. Obviously, washing your hands, making sure that our classroom environments are safe and well ventilated. All of these protect all of us from infection.
Well, good. Thinking of that in my mind, I had filed a bill on HB 724 last time protecting our kids, and that was requiring childcare facilities to report health metrics, just for the parents to know that how many kids are coming there and who is vaccinated, who is not, just for the public health knowledge. So that was, I think, was a good idea. Doing
Yes.
that. There are some after newborns, like before they have been discharged from the hospital, they will get some vaccination.
Mm-hmm.
Is it too early? Is it safe? Parents should not worry about?
Yeah. So three different shots that they could get while they're newborns. One is a vitamin K shot. That is a vitamin shot. It's not a vaccine, but it's really important to protect blood clotting. Without it, babies can get bleeds in their brain and cause brain damage, which is there for the rest of their life. So that's one important shot they get. A second important shot that they get is the hepatitis B vaccine. The reason why we can give this vaccine so early is because it's so safe. We try and give the vaccines as early as we possibly can, because why wouldn't you want your child protected as early as you possibly can? We know that this vaccine protects against hepatitis B, which, if you get it during childhood, it a lot of times becomes chronic and can lead to liver failure or liver cancer later on in life. And the third it's not a vaccine, it's an immunization, which means it's giving you antibodies. It's not a teacher going in and teaching the class. It's just actually throwing that lesson plan in your body to begin with. And that is RSV vaccine, and that's just given during RSV season to newborns, either at the hospital if they carry it, or at the doctor's office as soon as you see your first visit. And like I said, that one to me is just an absolute game changer. If you look at pediatric hospitals, normally during October, November, they are overwhelmed with babies with RSV, which is an illness which makes it hard for them to breathe. If we can get all the babies immunized with this immunization, they'll have to change staffing at hospitals.
Wonderful. Is there any set of vaccine a kindergartner should get before starting?
Sure. A lot of the ones that I mentioned earlier, so the MMR, polio, DTP, hepatitis A and B, varicella, pneumococcal vaccine, Hib, those are all ones that we give in early childhood. Flu if it's flu season, COVID if it's that season as well. Then there's some other ones that they're giving during adolescence, and in Texas we normally look at 7th grade.
And the people starting elementary, would that be covered when all these kindergarten vaccines, or they have anything booster they have to take?
Elementary, no. We hit another round of boosters around the time they turn 11. Okay. So that's when they get that. And then when they're 16, they'll get their booster dose of a meningitis vaccine.
Okay. So that's what I was trying to break up, because for the parents to remember, kindergarten, elementary kids, back to school, or middle school, back to school, high schooler. So set of vaccines. So mostly secondary and high school would be boosters at that point.
They get the HPV vaccine,
okay,
and the meningitis and meningococcal meningitis vaccines are new vaccines for when they turn those ages.
Wonderful. Well, anything else would you like to share from your experience, some personal or some professional story of vaccine doing a good job, or people who did not take vaccine and unfortunately get affected in a wrong way?
Yeah, I just wish everyone could see the lens I can see through, and all pediatricians. When we train in hospitals. I've been now a pediatrician for 25 years. My biggest memory in the hospital is standing over a patient with meningococcal disease. And my infectious disease colleague, I'm sure, here has stories like this. This was a teenage girl who was in the ICU, was on what we call pressors, was on antibiotics, was on IV fluids, maximum care she could get. And we saw her limbs turning black in front of us because of this bacteria. When I talk to the residents now who are working in the hospitals, they've never seen a case of it. Never seen a case of it. So something that was so striking and caused so much fear during our residency. And when I talk to the physicians who are a little bit older than me, they have those same stories, but about Haemophilus meningitis and epiglottitis. I'm young enough that I unfortunately did not see that. You talk to people a little bit older, you'll hear stories about measles and about polio. We feel so passionately about these vaccines because we never want your child to be in that situation.
Yes, I mean, I've seen people who have families in the third world or places where all these vaccines are not available or not accessible for unfortunate reasons. They will have the story like, hey, well, my brother has polio, or my sister, or one of our sibling passed away, or this or that. And we were fortunate about in America to have all these preventable things that we can prevent, because it is sad that one life lost from preventable cases is one too many, and we need to work for that. So thank you for sharing that. I've seen in my practice when COVID happened and when people were all flocking in the hallways and ERs and the floors and ICUs, and mostly people coming to ICUs admitted with complications were the one who were not taking vaccine. And they were all promising, like, give us the vaccine first before we will leave the hospital floor. We don't want to come back this again. So we have seen those stories. I hope people relate to this and follow up. Well, thank you for your time and appreciate your service to medical practice. Thank you. Dr. Naguib.
Yes, sir.
How are you?
I am good. Amarillo is beautiful here. The weather is nice.
Well, thank you.
60s. We're all good.
Well, wonderful. Maybe one of these days we'll come visit you.
Yes, sir.
And maybe have some barbecue with you.
Of course.
Thank you for your time. We appreciate that. Multiple specialties, nephrology, infectious disease, primary care. I mean, is there anything that you don't do?
I'm a master of business administration, so I do some administrative work also.
Look at that. Well, wonderful. Well, I take pride of having a quadruple board certification myself with internal medicine, geriatrics, hospice, palliative care, and long-term care. So I can certainly relate that to, wonderful to have you with us. Infectious disease is your forte, and you've been seeing, and I mean, you do other things, but I'm going to focus on your infectious disease hat today. So from the infectious disease point of view, how do vaccines help reduce transmission and the severity of the disease in the community?
Well, vaccines,
in the layman term.
Yes, introduce a dead or inactivated microbe into the body. So the body recognizes that illness, makes antibodies to attack it. So when and if the infection actually happens, the body is prepared to smother that infection and get it under control.
So it is important for the people to follow the schedule, and when they've been said that here's the window, take your vaccine, they don't wait, and then should take it.
Yes, that's the simple version of it. Of course, there are some vaccines that are not dead microbes, but they're inactivated, we call it. They're incapable of causing disease. Some of them are actually a simulation of an actual microbe, but they're manufactured in the lab. But nonetheless, the concept is the same. I'll share with you a simple story. When I had the COVID myself, I was fighting the COVID for a full year, and by the end of the year, right after Christmas, I fell ill myself. And I remember myself looking at the ceiling in my bed and saying, which ICU should I go to now? It was bad time, oxygen's going down. Luckily, at the time, the vaccine was out, but of course, it's too late to get vaccination. At the time, there was something called a passive immunity, which is the monoclonal antibodies were available. So the city health department had it in Amarillo here, and I couldn't walk. So actually, my wife took me there in a wheelchair. got the IV shot and got the IV fluids with it, and went home. And next morning, I was completely different. So it made a believer of myself, because these are things that at the time we were wondering about the efficacy of it, but I saw it in myself. We all remember that we had a president in the United States 70, 80 years ago with polio. We don't see polio anymore. We do not see these illnesses. Wouldn't we wish that HIV would have had a vaccine, even if it's 50% efficient? 50% efficient, people look at it as failure vaccine. Cutting 50% of the HIV burden in the population is a huge thing.
Plus, nowadays we live in a global world. I mean, it's not that people live in their own pockets, and it's not that some breakup will happen in some part of the world and you're okay. This is just one passenger sitting on a plane and coming here, and then that certainly all of a sudden, whatever the infection outbreak was happening on the other side of the world is right here with you on your face. So we have to be extra smart, extra careful, extra efficient.
Very true. It's a very small world. We had Ebola coming from West Africa to Dallas in a matter of 10 hours, landed in the middle of Dallas, Texas. In Amarillo here, we were just panicking. What are we going to do now? Obviously, we have lost a lot of protective gear at the time of the COVID, and all of a sudden we're exposed with people coming. We don't know from where, but they're in a flight and they're landing all over the country. So if we have a vaccine that is 50% efficiency, that is a big thing to have.
So quick overview of adult vaccines that matter most to prevent outbreaks of in high-risk settings. What would that be?
Well, the usual annual flu vaccination is very important for all of us. All of us are subject to flu, and flu sometimes, we think of flu as a simple illness, but that could take us all the way down to the ventilator, and it has mortality. Yes, it's a low mortality, but it has mortality. So flu vaccination, annual flu vaccination is an important issue. All of us, we know we just came out of a COVID pandemic that ruined all the routines in our lives and changed the way we think. This is something that we should be updated on. The elderly population, just like the infants and the kids, RSV is a big thing at this point, because older gentlemen and ladies don't have the same immunity like when they were young, and RSV becomes sometimes a heavy, devastating illness. Of course, pneumonia. The pneumonia vaccine is very important, and since the advent of the pneumonia vaccination, pneumonia cases due to pneumococcal pneumonia are much less than before.
So when you're wearing your infectious disease hat, is a lot of people that you see. What are some stories that people come with, some misconception you hear about vaccine and infectious disease?
Oh, there is that story of you're doing the DNA and RNA vaccines so that they can take over our nucleus and control our brains and so forth. And if this is the case, I wouldn't have taken it myself. And all these educated people who are into the science are all vaccinated. So if there's a risk here, we wouldn't have done that.
Well, good you brought up in DNA and all that. So the COVID vaccine, mRNA, that was something new, unconventional. Talk about that, and so talk about more about COVID vaccine.
Yes, the vaccine, bottom line, makes the body cells generate the epitopes similar to the virus so that the body can recognize that and attack it. The vaccine in general is very safe, except for the local reactions. The studies were done, were published, and different vaccines were done. Now, the COVID has different forms of vaccines, the mRNA vaccine, and also other vaccines that are conventional vaccines. So if somebody doesn't want this, he can use the older vaccines that I don't want to mention proprietary names, but there are vaccines that can be used that don't have messenger RNA technique. But all of these vaccines are pretty safe. Now, we have to remember, we have 8 billion population in this world. And if these vaccines are actually going to cause serious or significant damage, we would have seen that all over the place around us.
So one thing I was hearing about COVID was, oh, it came out so quickly. It must be something fishy. You cannot make the vaccine. Sometimes it takes a long time, but this one is different. And I was telling them, look, whenever we are doing research, there are multiple prongs to it. One is that you research and you find, then you will have to have multiple studies on it to make sure, study one, level 2, level 3, and then no harm, then no harm, and then you come to humans, and then you do all that part. And then funding plays a big role in that part, and then the mass production that happens, right? So the COVID part, as I understand, since it is mRNA, it already bypassing one stage where you're inoculating the what you call inactivated virus. So we are not doing that. We are directly going into the cellular level where the mRNA is having this. So we save time there. Then I was saying that there was also issue of studies that you don't find multiple study happening since this happened globally. So the studies were going simultaneously across the world, and then we were able to find data so quickly. And then finally, it was funding part. A lot of pharmaceutical will not mass produce anything if it's not approved. In this case, there was a pre-approval from FDA, and the funding was there that go ahead, do the mass production, right? So we saved time at various levels, and that's how this vaccine came out so quickly. So there's no black magic behind it, or there's nothing that it was, some fishy things out. What are your thoughts? Are you agreeing what I'm saying?
Yes, I sure agree. The extreme situations require extreme measures. We have to be nimble. We have to be on our feet. We have to appropriate fund, move money, move research, support research, and go with the clinical studies. The clinical studies were done in the United States, were done abroad, and they showed that there is clear benefit. Now, we're not going to argue about 90% or 98% or 68%. Like I said before, a vaccine in a serious disease like that, even if it's 50%, it is really needed. And this has been proven in a short time. So that is really the shortest time that we have been very efficient bringing about a successful vaccination.
In Texas, where do you see the biggest opportunity or obstacle in keeping the outbreaks in check?
Measles is scare at this point. We don't want to get caught with the pants down, so to speak. So measles is the time to vaccinate the kids and make sure that we don't go back to the good old days when measles was claiming a heavy casualty on the populations.
Any practical advice for the families or for the clinicians?
For the families, you worry about your kid, you worry about the future of the kid and the health of the kid, and also the health of the rest of the people in the same family. So, again, it's a risk versus benefit. The risk is not much at all, the benefit is tremendous. So, for all of us, we need to really look at numbers, look at the risk versus the benefit, because this is not a time where we say, oh, it may cause me a problem. I'm going to stay home and not take my shot. And then at the end of the path, we're going to have to hurt other people without meaning it, hurting friends, hurting family, hurting neighbors, hurting population around us. The disease spreads, and the disease knows no boundaries without being vaccinated.
Absolutely true. That's what I tell a lot of people, that, when these disease, for example, diabetes hits, it is going to hit you. It doesn't see color of your skin or what is your faith or even you vote or don't vote. The part is if you're taking care of it or not. Are you compliant or not? Are you taking treatment or not? And I've seen people with diabetes with 20, 25 years having a normal life. And I've seen people with diabetes with 4 years and amputated leg and going blind or going on dialysis. So the access to care is important, and taking care of oneself is important. Thank you for your time. Let me shift back to Dr. Carlo. What would you say to a person who says, "Hey, I am American. I have my own freedom. I right to choose. I don't want it. I don't want vaccination."
Well, I think, and we are hearing a lot of that more and more, unfortunately. And I would start by, talking a little bit about our history. And one of the things I find very remarkable in our not too distant past is how really being an American was really stepping up at the time of the polio vaccine campaign. And it was really the civic duty of everybody that stood in line and got the vaccine and the immunization, and did it not just for themselves, but for their family and their community. And so, I sometimes you can't change people's perception on this, but I do think that we got to do our best to at least inform people that there certainly was a day in America's history where there was a different storyline that was very, very prominent about community service and what it really meant to be an American in terms of stepping forward and doing what's best for our community. And I still believe that. I do think that this is really the story of the vaccine as we talk about. It doesn't really work as well unless we all step forward and get it. It's doing the best that it can, but there's so many people that aren't going to benefit by it because the immune systems or other reasons are just not going to make it as effective. Vaccines only work if we step together and talk about it from a public health measure to really affect the community. And I think that sometimes we have oversold the individual benefit in many ways at the expense of really forgetting about why it's better for everybody to get the immunization.
Well, thank you. And I think you touch it right. Being a leader is more about society and greater good than about ourselves. And we need to remind ourselves that as an American, if we want to be a leader, then we need to think about greater good. Thank you. Thank you for your time. Dr. McGee, we are seeing a lot of this funding cuts that are happening, and the research has been stopped, and a lot of departments have been cut. How do you see this? Are you seeing any effect right away, or what do you see it like? What is you're seeing in present, and what are your concerns for future?
My real concern right now is a loss of the family of the medical practice home. And I think that these are conversations with concerned parents that need to happen over time sometimes, and that trust needs to be built between the physician and the family. And when you have potential Medicaid funding cuts, when you have potential cuts to ACA plans, when you have Medicaid that is underfunded, generally, reimbursement is low. And so providers may not be able to take Medicaid patients. That you lose that medical home. You lose, the reason why I went into pediatrics, a lot of it was because I remember my pediatrician, and you talk to everyone and they remember their pediatrician. And that was always one of their favorite people. And it was just such a trusted family member. And we lose that. When we lose that medical home and that continuity of care, and that's really it makes our jobs less fun. It makes parents more scared, and it's not good for the health of the nation.
More importantly, it's hurting people.
Yep.
It's hurting the society in their quality of life. Plus, also, I think it is a continuous effort that happens, right? I mean, a person who is not healthy enough would not be as productive, and even if is work on the work, or even they are skipping work. So if they're not doing that, you look at the person. If he is a businessman, he will be shut. His business will be closed for some time, right? So if the economic loss that happens and the revenue that they could have brought out, they don't have it, so they cannot spend it. So his business around his community is going to be affected, and then it's kind of a effect that comes in. So we need to make sure that we focus and continue the research, and we should focus and continue the funding, so the Americans as a whole can benefit out of it. Well, thank you
And
so much. Yes,
as a
please.
pediatrician, I even think about younger than that, right? So when we have a mom who's carrying a child who is undernourished or not getting medical attention, that baby may be born prematurely, And then when you have a child who is living in a home with parents who are sick or doesn't have access to medical care, they're not learning when they're in school. So you're not even talking about a short time out of the employment. You're talking about a lifetime where haven't reached their full potential.
True, and all these you brought up Medicaid, and there's so much cumbersome applications and applying, and their qualifications, and unfortunately, people who needs the most have the most challenges. So actually, I had the bill HB 1539 for continuous eligibility for people and children under the age of 6, so they don't have to repeatedly, or their parents doesn't have to repeatedly show their income based what do you call reevaluation criteria and get the waiver. They can get it. We had a bill 514 for maternal health and having more people in that field. Well, thank you much. I think we have taken much of your time. Any last thoughts, if any of you have it, please feel free. We can start the rounds. Dr. McGee, you want to go first? Any parting thoughts?
Just like I said, I've just tried and stress, having those conversations. Don't believe everything that you see on social media. I'm glad that we're getting out there on social media to try and correct some of this bad information that's out there. But don't necessarily believe everything you see and hear. Find that doctor who you trust, find that healthcare provider who you trust, and have those conversations with him or her.
Thank you. Any parting thoughts, Dr. Naguib?
I would love to see Medicaid maintained and affordable for the population that is don't have the means. And I'm sure that you're doing a great job in that. And I'm sure that hopefully the rest of your colleagues will support that, because we need vaccinations, and Medicaid supports vaccinations and prevents. And the dollar that's spent on that saves billions of dollars spent on actual treatment in the ICUs and in the hospitals.
Well, thank you. Appreciate for bringing that point. Being the only primary care in the legislation, I'm trying to educate my colleagues that we're spending money. We're spending money in healthcare, but we are penny wise, pound foolish. And then we can do better. We can do better by focusing more on primary care, preventive care, not only improving the quality of life of people, but it's also stronger thing for all Texas, even a stronger economy that will come through it. So we're trying. I have filed a couple of bills for Medicaid expansion. We're also reviewing other states, blue and red states who have done Medicaid expansion, and trying to see what are the best practices and how can we bring it to Texas. So we are working on it. Thank you so much, sir.
Excellent.
Dr. Carlo, any parting thoughts?
Dr. Lalani, thank you for assembling this group, and thank you for your service to the Texas legislature. I think this is a critical time for public health, and this discussion is critically important for what we all are trying to do in our communities to ensure our patients are healthy and really ensure that the community stays healthy. So I don't think we can talk enough about the importance of immunizations today, especially coming off of the COVID pandemic and all the other infectious disease threats that we are facing every day. So I think it's doubly important to continue these conversations, and I appreciate the opportunity to be here tonight and talk it over with my colleagues and you tonight. Thanks.
One last thought that just comes to my mind, that this pandemic it keeps on happening every few years that happens. How we can be better prepared for the next one? Are we prepared? First question. Number two, how can we be better prepared?
I think I think we're going to be struggling to be as prepared as we were because of what we've faced in terms of the infrastructure with public health in our communities, and that's an effect of all we've been through with COVID. And there are other infectious diseases such as influenza, the avian influenza outbreak that happened in our poultry just last year reminds us that we still have many, many other threats out there. And so I think that these conversations are critically important, especially now when we have greater distrust in public health and we're continuing to lose, I think, the impression of what works in terms of science, especially around immunization. So I think these discussions are incredibly important right now.
Well, thank you, doctors, for your time and your expertise. And we appreciate that. And hopefully we'll have another opportunity to connect with you again. For all our listeners and viewers, again, we are living in a time of misinformation, disinformation, or information overload. And we need to make sure that we can differentiate facts from the fears. We need to make sure that we differentiate knowledge from noise. To my colleagues, let's put people over politics. That will be a stronger Texas for everybody. God bless.